any neck lump is caused by a problem. The vast majority can be related to infection, and they will usually get better within 1 or 2 weeks. We recommend that any neck lump that's present for longer than 3 weeks should be discussed with your GP, and then that may need to be referred on to a specialist, so a head and neck surgeon, to evaluate it further. And this is because there's a vast range of conditions that can cause it, from simple, what we call skin lumps, so these are sebaceous cysts or lipomas, which are fatty lumps, to benign growths on the structures, and to cancer. And that may require specialist assessment and investigations to help with diagnose and then treating the problem. So a neck lump, usually if it's associated with infection, can be painful, or if they are sometimes related to something called an abscess, where pus has collected under the skin. But on the other hand, many neck lumps, and especially more persisting neck lumps and even cancer, may actually be painless initially, though they can develop pain later on. So the important thing is getting a diagnosis. So that will require taking a history, really looking at how long the lump has been present, where it's located, how long it's been present for, what other symptoms the patient has. They will then have an examination, and this will require both feeling the neck, looking in their mouth, their nose, their ear, and we will also look in their throat with a little telescope, which is all done in the outpatient clinic. Depending on what the findings are, we can give a diagnosis straight away for certain conditions such as sebaceous cysts or lipomas or fatty lumps, but many will require further evaluation, and that will usually be an ultrasound scan of the neck, which will help identify what is going on, and we will sometimes arrange for a biopsy to be done as well, which is done using a very small needle to get some cells to look at under the microscope. And we may also arrange to have some blood tests done to look for signs of infection, or depending on which structure is involved, to see how that is functioning. And then depending on that, we may also need to do a CT scan or an MRI scan to allow us to reach a diagnosis. Depending on the diagnosis, we will then discuss with the patient, and some can be left alone. Some may be treated with medication. So typically these may be for infections where antibiotic is required. And then some may require an operation to either remove the lump or lumps in order to cure the problem. But this is a very broad topic. So I think it's too broad a topic for a single video. But this is why it's important to see a specialist in this area so that this can be accurately diagnosed and managed. So as I explained earlier, this does really depend on what we are dealing with. So common neck lumps may be related to a salivary gland, and this may then require an operation to remove the lump and the salivary gland. Another common one are nodules related to your thyroid gland. And whilst the vast majority of these can be managed without surgery, some may require surgery if they are suspicious or show evidence of a cancer, or if they are large and causing the patient symptoms. The other big group are what are called lymph nodes, and these do come up with infection, in which case we don't need to operate on them, but unfortunately they can also be a sign of cancer, and that may then require surgery as part of the treatment of the cancer. But again, it's very important that these are seen and assessed properly by a specialist who has an expertise in this area, so that they can have a full discussion with the patient of the diagnosis and the various management options that are available to them, because surgery may not always be required or needed.